Bismillahirrahmanirrahim. Assalamu alaikum and greetings from London. I would like to thank all the faculty for inviting me to this opportunity. Today's topic that I'm going to discuss is urban planning and environmental policies. And I'm going to present a multi-sectoral policy approach to build healthy cities of the future. In order to discuss that, let's talk about the 5 areas that we will discuss. We are going to talk about key sources of pollution, housing and urban planning needs, greening the health sector, global and national commitments, and finally, a multi-sectoral policy approach for cities of the future. To discuss those objectives, let's first set the stage and discuss what are the common causes of pollution. So the major cause that I would like to start with is the population overgrowth. And because of that, we see a huge transportation issues in the urban centers, such as transportation emissions. There are also industrial activities, construction, energy production, waste management, and secondary pollutants. What those causes cause in terms of its impact on the climate change. According to the World Meteorological Organization, there is an increase in the sand and dust storms. Other findings also suggest that there are increased number of wildfires, urban flooding, heat waves, and on the medical side, the antimicrobial resistance and mutations in the viruses, which often causes pandemics. And when WHO did the mathematical modeling of the pandemic's probability, they found that there are 28% chances of another pandemic in the next 10 years. And furthermore, there are 57% chances and probability of a pandemic in the next 25 years. And this is a very significant finding. Now, in order to discuss those issues, WHO, the World Health Organization, suggested urban policy approaches, which they named as healthy and resilient cities. In order to discuss that one, I will discuss those issues both from the economic perspective and health and well-being perspective. So what are those sustainable solutions for economy and health? When we bring them together, we can probably get more benefits than only achieving them in parts rather than as a whole picture. First of all, what WHO defines as a healthy city? A healthy city is one in which continuously creates and improves its physical and social environments and expands community resources that enable people to support each other in performing all the functions of life and developing to their maximum potential. Now, based on insights from WHO, urban planning experts, and global policy frameworks, we design policies to develop urban centers that are both economically productive and healthy. And this is the way they support each other. It requires a blend of strategic planning, inclusive governance, and sustainable development. So both economic development contributes to health and health contributes to the economic development, and they go hand in hand, which is why we need to discuss both of those sectors and provide the policy options. So on the economic sector policy options, I would like to give 3 main principles. Principle number 1 is about local economic development strategies. We need to promote economic clustering, which means establishing technical hubs and financial districts and make the most of the opportunities. We need to support small and medium-sized enterprises and local entrepreneurship. Efforts are needed to foster public-private partnership for infrastructure and innovation. And similarly, we need to integrate economic planning into city master plans. The second important economic principle that contributes to health is the efficient land use and infrastructure. We need to design spatial master plans to guide growth and density. In addition, we need to ensure access to transport, utilities, and digital infrastructure. And here I'm referring to the public transport. And also use land readjustment schemes to support low-income housing, because this is also a very important sector. And the third economic principle that contributes to health is investment in the human capital. We need to develop skills training and job creation programs. We have to attract and retain talent through quality urban living conditions. And we need to encourage innovation through education and research partnerships. So these were the economic factors that contribute to better urban health. But also, what are the health policy principles for urban healthy centers development strategies? The first one on the health side is called approach defined by WHO as health in all policies. What is health in all policies? Here we need to embed health consideration in urban planning, transportation, housing, environment, and all sectors of life, so that the health focus is present in all the master plans. We also need to use tools with the other sectors to work together through joint strategic needs assessment to guide local health strategies. The second important health principle is access to health services and healthy environments. We have to plan for healthcare facilities in growing urban centers and also promote active travel such as walking and cycling and electric vehicles, create more and more green spaces, and promote clean air through various methods. We also need to design healthy high streets that encourage social interactions so that people could come together and they feel like part of the society, and we try to reduce inequalities among various segments of the society. And the third one is on the health side, the community engagement and equity. We need to empower communities to co-create solutions. Also, we need to address social determinants of health like poverty, housing, education, and many other sectors to provide facilities to the people. And finally, we need to target interventions to reduce health disparities, because by reducing health disparities in the neighborhoods, we create a very productive society that is growing together and in a very healthy manner come together to find solutions for all those problems. Now, these are the various policy tenets on the economic development side and the health development side, which reinforce each other. But besides that, we also have a certain global and national commitments that we have to improve together. And those commitments are mainly, I would like to discuss four commitments. The first one is the Paris Treaty on Climate Change, which was enforced in 2016, and various nations signed the treaty and agreed to targets which they want to achieve together on the climate change. The second most important area of global commitment is the 2024 Conference of Parties, the COP29 summit, and Pakistan also participated in that. And the main theme of that summit was to limit global warming by 1.5 centigrade. Another upcoming event is the 2026 World Urban Forum number 13, and the main theme of that forum is housing crisis. And finally, I would like to mention here that if we talk about all those global and national commitments, ultimately we reach to the 2030 Sustainable Development Goals, which all the nations of the world have committed to achieve together by the year 2030. So, if I conclude and summarize all the various policies, issues, reasons, causes together, then I would like to come to the conclusion of healthy cities of the future through certain principles and activities. What are those principles? The principles are the multi-sectoral policies on technology and innovation, education, and prevention. And if we act on them, we are going to achieve at least the 5 SDGs, which is a major contribution. Now, what are the activities that we need to do? The activities that we need to do is the decarbonization of sectors and decarbonization of all sectors. But I would focus on hospitals and the health sector because hospitals are one of the major contributors to the waste, which is both biological, human, and other forms of waste. In addition to that, the other activity is greening of parks, streets, and communities. Most importantly, we need to improve the public transportation and increase the use of electric vehicles. These are the collective activities. But at the individual level, we have to boost our immunity. We need to develop our immunity through better nutrition, exercise, and practicing equity among various segments of the society by good social interactions. At every level of society, we need to promote information, education, and communication about those issues. And this is how we are going to achieve them. But the final sector, which is very important, is financing for development. At the global level, we have a fund called Climate Fund, and countries can get support from the Climate Fund in order to make sure that they are able to implement their climate change master plans, to make sure that whatever targets we are promising and committing, we are able to achieve them. And that can be done together when we all put together our efforts, and which is why I really appreciate this effort of your university. And in the end, I would like to thank again and finish this presentation with all the best for this conference and various sessions and issues that will be discussed. Thank you very much.